Hello, everyone. Thank you for joining us. My name is Kristen Rivas, and I have been a certified hypnotherapist since 2009. And I have a very special guest with me here today. Her name is Dr. Alisha Ghajar, and we are going to be talking about the physical reasons for anxiety and what we should do about them. So I'm going to give you just a little bit more information about Dr. Ghajar. She is a licensed naturopathic doctor practicing at Natural Medicine of Seattle in Seattle, Washington. She graduated from the prestigious Bastyr University and completed a rigorous 2-year residency focusing on chronic illness, environmental medicine, and IV therapy. She is a member of several professional organizations, including the American Association of Naturopathic Physicians, Washington Association of Naturopathic Physicians, Gastroenterology Association of Naturopathic Physicians, and the Institute for Natural Medicine. When she is not treating patients, Dr. Ghajar enjoys hiking in the Pacific Northwest, gardening, and creating delicious, healthy meals with her husband. So, Dr. Ghajar, Alisha, thank you so much for being willing to share your really wonderful knowledge with our listeners today.
Thank you so much for having me. I'm really honored to join you.
Yes, I wanted to take a moment to let people know why we felt this was such an important conversation to have. Most people who will be watching this are familiar with my story, that I became a hypnotherapist because I suffered from what really became a life-threatening, debilitating illness that today is called functional neurological disorder. At the time the Mayo Clinic diagnosed me back in 2009, they were calling it conversion disorder. But they said that these seizure-like symptoms that I was having, things that resembled things like Tourette's or narcolepsy or multiple sclerosis, dystonia, all these crazy neurological dysfunctional symptoms were a result of repressed trauma that needed to be treated, kind of like how a person might develop panic attacks after something traumatic. And I thankfully got really wonderful results from hypnotherapy, but that came after almost 2 years of a diagnostic process to check and see what, if I'd had a brain parasite or my thyroid levels, my nutrition. And there's a lot of clients that I see that have been suffering from something like anxiety or depression, and they have not gotten thoroughly assessed by a doctor. Or if I check and see what their doctor did to assess their anxiety, it really hasn't been much. They might have had like a 5 or 10 minute appointment and were then written a prescription for anti-anxiety meds. So I know that you have given a lot of value in my life. Like, you've helped with my health, you've helped the health of my loved ones and my clients by giving them really great treatment. So I am very honored to have you here sharing your knowledge with this audience. And I'd first like to ask you, Alisha, if you wouldn't mind sharing basically what a naturopathic doctor is, as opposed to what we could call an allopathic doctor, known as an MD. So the difference between an MD and an ND, and also what led you to becoming a naturopath, just so people get a sense of that, if you wouldn't mind sharing. Thank you.
Sure. Yeah. Thanks for that intro. So a naturopathic doctor has completed a very rigorous education. They have had to attend one of very few licensed universities. And the program is 4 to 5 years after completion of your bachelor's degree. It's complete in sciences, it's complete in pharmacology, it's complete in medical treatments that we all are familiar with. But naturopathic doctors also learn about herbal medicine. We learn about physical medicine. We learn about homeopathy. We learn about nutritional therapies. And so we have a much larger toolbox at our disposal. The way that we work is more patient focused. We have just the luxury of a little bit more time with our patients than maybe an allopathic physician would have. You know, your first office visit with me is 60 to 90 minutes, and
Wow.
follow-up visits are 30 to 60 minutes. So, and it depends on the complexity of the situation, but our visits are much longer. And in that sense, we really get to know our patients. One of the major differences is that we don't see you as a person, as an anxiety case. You are not an anxiety case. You are an individual with anxiety, but you are a whole person. And so we have to evaluate you as a whole person. We also always want to try to find the cause and treat the cause of a problem. So, you know, just like a rash, you might just be given a cream and sent out the door. We actually want to know, why did you get that rash, and where did it come from, and what do we need to do to prevent that from happening? So those are some of the major differences. It's very collaborative, and I think most of us would say that we're in it because we want to see long-term healing, and we really believe in prevention. So that's sort of like our foundation.
Wow, thank you. Yeah, unless there's anything else you'd like to share, any of the reasons what led you down that road, we can move on and get into our questions.
Yeah, I think what led me down the road was just all of that I saw my family sort of suffer with lots of diabetes, cardiovascular illnesses, and kind of get nowhere. And it led me to becoming a dietitian. And then I wanted to do more, so that I became a naturopathic doctor, because just in conventional medicine or allopathic medicine, we often saw that diet was completely left out of the treatment plan, or lifestyle modifications were completely left out of the treatment plan. I think those physicians simply didn't have time or the education to provide that information. So I just think we can do a better job providing sort of patient-centered whole healthcare.
I agree. I think there's a big need for that. And I think that there's still, of course, a lot of things that, as you said, conventional or allopathic medicine is quite good at, and yet there are some things that I just wouldn't rely on them for. And that's one of the reasons why I wanted to get a very good picture of, in case people listening to this, watching this, might not have ever been familiar with a naturopathic point of view, since there is so much of the other view out there. So thank you for that. I will go ahead and launch into my first question for you. We've got just a few here. And the first question is simple, but kind of a big one. That would be, I would like to ask you, what are the known medical reasons a person may experience anxiety and anxiety attacks?
Yeah, that's a huge question.
Isn't it?
There are many medical causes of anxiety that are not in a person's head, that are physical within their physical body. You know, I think we start with medications. Lots of medications can cause anxiety. It's more common if you've just been put on them versus if you've been on something for years, but different cardiovascular drugs, antidepressants, certainly steroids can cause anxiety, and thyroid medications, especially when we're titrating up or down on the doses, those can cause some anxiety. Various substances that are common, like nicotine or caffeine or alcohol, can cause anxiety. Interestingly, people think about marijuana being a very calming agent. For some people, it actually sparks extreme anxiety. We've seen that before. And then drugs that just are prone to abuse, such as opioids, cocaine, amphetamines, and Valium or Xanax. Those can certainly, either taking them or trying to withdraw from them can cause anxiety. Even things such as like really benign supplements like vitamin B12, lots of people just take vitamin B12. In certain people with certain genetics, it can actually cause a pretty extreme anxiety and jitteriness, and we have to be careful how we dose that. And then I work in environmental medicine, so I'm really concerned about toxins in the environment. Lots of heavy metals, including lead and manganese, can cause anxiety or mimic anxiety. Pesticide exposure, carbon monoxide poisoning, different solvents like paint solvents, and mold toxins. So the mycotoxins that are released from toxic mold in a water damaged home, those can all cause anxiety. And then, so those are things that we take into our body. And then there are actual just physical conditions. So it's a huge list. And just to touch on a few that are like the most common, I would say like cardiovascular conditions like arrhythmias, high blood pressure, mitral valve prolapse. Those can cause a sense of panic within the body that feels like anxiety. As can asthma, as can COPD, which is like emphysema. Anytime you have an injury to the brain, you can feel anxiety. So that would be like a stroke or a head injury from an accident or a neurodegenerative disease such as Alzheimer's. These all can make you feel anxiety. Thyroid disease is probably one of the most common things we work up if a patient presents with anxiety. And then anytime your hormones are imbalanced or your electrolytes are imbalanced, we really think about that can definitely be a contributor. If your blood sugar is too high or too low, if you are if you have nutrient deficiencies or nutrient excesses, various infections, the list is really exhaustive. So we could spend a whole day just on the causes.
I didn't, like, as you say them, they all make sense. Maybe I've heard it before passing by, but I really haven't heard it emphasized so much. In fact, for instance, even you said nutritional deficiencies, but then you said like when they have too much of it, right?
Yeah.
When somebody has too much. I've never heard that before. That's interesting.
Yeah, you can definitely take too much of a good thing.
And then the last thing you said, did you say infections?
Yeah, certain infections can cause it feels like anxiety. So when a patient who's maybe never had anxiety before, the word anxiety might be the first thing that comes to their mind, but any situation that puts the body under severe stress, such as an infection, a really bad infection, it can cause a stress response in the body that the person perceives as anxiety.
That's interesting, because I've heard some clients that have battled, for instance, even with something like UTIs, talk about anxiety before, or even a sense of depression, which, man, the body is so fascinating. I wish we were given an owner's manual when we were children so that we could know. Right, that would be good. But thank you for taking the time to inform us of such a list. Good to know. My next question for you would be, if you were to get a patient who doesn't have a history of traumatic life events or chronic stress and reports themselves as never having been an anxious person, as someone with great stress management and self-care routines, what would you suggest they do to both find the cause and treat the symptoms of anxiety?
Yeah, I think most of us don't have great stress management. But say that a person does, and they are reporting some new onset anxiety. You have to be really deliberate and really careful as you go through the process of diagnosis, just because that list that I gave you was so long.
Absolutely.
We have to, first do a super thorough intake where, we definitely need to talk about diet. We definitely need to talk about medications, recreational substances, lifestyle habits, sleep habits, anything that could be an obvious trigger for anxiety has to be addressed and ruled out. And then part of the intake with a naturopathic doctor is to go through a full review of systems. So that's a head-to-toe analysis, and we talk about every single body system and see, are we missing something? Is something going on? Is it because you have an infection somewhere that you've just been brushing off, or something like that? And is there anything maybe some underlying medical condition that with appropriate treatment could resolve the issue? So we go head to toe, and then after that, we'll do a physical exam. In COVID times, maybe not the physical exam, but if possible, it's always great to get a physical exam, check in on things like blood pressure, heart rate, listen to the heart, really get a sense of the physical body, and then figure out if there are any labs we want to run. So a lot of these things can be diagnosed off of a simple lab test. It doesn't have to be an expensive, alternative set of labs. It can just be really standard lab work. So we would start with the getting to know you part, and then we would go into the physical part, and then we want to talk about, okay, now let's evaluate some lab work and see what else is going on.
Wow. Yeah. Thank you. That sounds like a very thorough. Yeah, no, it sounds like definitely a thorough process, but it sounds really helpful. Mm-hmm. It sounds like somebody will be very, very well taken care of.
It's pretty exhaustive, which is
yeah, that's good. Yeah. So I guess a follow-up question for that would be, like, while somebody is going through a diagnostic process, maybe awaiting results, answers, what are some things that you would recommend to a person who's experiencing the symptoms of anxiety so that they can find relief?
Yeah.
As much as possible in the meantime, I guess.
As much as is possible, if there is a physical issue going on. Mm-hmm. I would say, so I do have a background in nutrition, and I just don't have a visit that doesn't have a nutrient component to it. Mm-hmm. So I always have a diet conversation. And if I have a sense that there is a dietary component to that might be making it worse, might be making the anxiety worse, then I'll address that and suggest, that we balance the diet a little bit more to reduce the opportunities for anxiety. In addition, I really love biofeedback, and I really love some other tools that I know probably a lot of eye rolls, but like meditation, breathing exercises, they really do help. And even gentle exercise such as Tai Chi is very helpful for anxiety. Even if there is a physical issue, those tools are likely to be helpful in just calming the body's response to the stressor. And then if I really think that there is a nutrient deficiency, if I have a strong suspicion based on that first visit, then I might recommend a supplement. But I usually have to have a pretty strong suspicion with the absence of lab work.
Thank you. I know that sometimes when I've asked potential clients who call me up and we have a consultation, if they've practiced meditation before, that sometimes they will say, like, oh, I didn't think that I was good at it, or that I was like finding like enough relief. And I think that maybe sometimes people might be looking for like a Zen level mastery of it, or experience of immediate profound relief, in order to think that it's in any way effective. Right. And I do, because of my own personal journey of like well-being, physical, mental health, I practice something called Transcendental Meditation that's given me great relief in addition to the hypnotherapy that I do, like self-hypnosis or guiding other people through hypnotic states as a part of the therapy, the counseling that I provide. And I have found that in my own personal practice of meditation, whether it seems like there's a lot of mental activity, a lot of thoughts, or whether there happens to be calmness or stillness, I still find that there is some benefit from having set aside the time to have a meditative experience. Like whether it seems like it was immediately very profoundly beneficial or not, I can like look back and see if I keep that habit up, especially like twice a day, every day for 2 weeks, there's a difference.
Sure. I would say it's rarely immediately obvious.
Right.
You know, I think it's more what you said, it's more the daily practice, even if it's just 5 minutes of
Right.
just quiet, paying attention to your breath. It really works wonders down the road. We just have to invest in it and keep up with it.
Yeah, so thank you for that perspective
Mhm.
that you of finding that helpful, because I believe that a lot of people, especially in this American culture that we live in, modern day, that there's a lot of responsibilities we have. We pack our lives pretty full, our days pretty full, a lot of us, and sometimes we're not given as much permission, or we're not praised as much for setting aside time to rest our nervous system, rebuild our energy. And I think that can make quite a difference for people. But all of that sounds really good. Do you have any suggestions on how our viewers and listeners can prevent the physical reasons for anxiety?
So a lot of the causes on my list are not within our control, right?
Mm-hmm.
But some of them are. So obviously, so I mentioned earlier about diet, and I'm just going to come back to that probably repeatedly. But poor diet choices will really wreck your mental health, especially if you're consuming a lot of processed foods that are really high in refined carbohydrates and sugar. Your body will release insulin to clear those sugars out, and then the resulting the dramatic drop in your blood sugar creates anxiety. And so your blood sugar does this, this back and forth business, and it can really contribute to anxiety. So it's really important just to eat a well-balanced diet, which is really rich in vegetables, whole grains, proteins, healthy fats, and avoid the more refined carbohydrates like pastries, white breads, white rice, the things that we might be baking more of because we're in isolation right now. Those foods are not as supportive. Also, you can always try to maintain a more active lifestyle, even if you're starting from ground zero and you can only go for a walk. Any kind of body movement helps discharge that anxiety. So walking outside, I know right now it's beautiful in Seattle.
Yes.
Walking outside is really, really helpful. Like I mentioned earlier, Tai Chi, you can find online resources for Tai Chi.
Nice.
In your living room. Moving your body is a really useful way to help shake off some anxiety. And then, if you are I just think that if you're suddenly feeling anxious out of the middle of nowhere, and it was never a part of your life, and all of a sudden you're feeling this way, your very first step is to see a qualified physician who will appropriately work you up for physical problems, and then make a referral if necessary to a psychologist, or for hypnotherapy, for whatever the whatever would be helpful that's not a medical issue. You need to make that first contact with a doctor just to get that process going.
I wholeheartedly agree. And I do get quite a number of doctors' referrals these days. And I prefer that somebody have seen a doctor first In fact, I have to ask a lot of people that want to see me to go see a doctor first. So
Yeah.
my next question would be, do you have any suggestions on what our viewers and listeners should look for in a doctor? So both in general and specifically if they've been struggling with anxiety. So things like maybe training, I don't know, education, any kind of qualifications, and even their like emotional intelligence skills, like empathy, listening, communicating. Any advice?
Yeah. Yes. I think, and I say this because I've heard negative feedback about other experiences my patients have had with other physicians. The very first, foremost important thing is that your doctor should listen to you. Your experience is valid. Your feelings are valid. You know your body better than I do. And so your doctor should never dismiss your symptoms or tell you that it's all in your head. So number one, you need to be heard. Number two, they need to take the time to be willing to discuss any diagnostic treatment options with you, or diagnostic and treatment options with you. And then they need to be able to answer all of your questions. So unfortunately, allopathic physicians often just don't have that time. So if they don't, then you need to find someone who does. You need to, we don't want to miss anything because you only had 5 minutes with that doctor. And in terms of the credentials maybe that you should be looking for, as long as that practitioner is licensed in their field, they just need to be accredited in their field. And so whether they're an MD, medical doctor, a naturopathic doctor, a DO, which is a doctor of osteopathy, an ARNP, they just need to be accredited in their field. And so it's not actually that difficult to get a certification online that says you're a naturopath or an osteopath or whatever. And those are not valid. Those people did not receive adequate training. And I just recommend going to your local, like your state association. So for me, that would be, for naturopathic doctors, that's the Washington Association of Naturopathic Physicians. That doctor should be a member of their local organization. And that's one way to make sure that you're seeing someone who's qualified.
Wow, that's very helpful. Thank you so much. That's really great to know. And I guess in closing, I'd like to ask, is there anything else you'd like to add on this subject to encourage anyone out there who's been struggling with anxiety or anyone looking to improve their emotional and physical well-being?
Yeah, I would just say keep in mind before you write yourself off as being an anxious person, just keep in mind that there are many, many, many physical causes of anxiety, and trying to work it out yourself can be very overwhelming. You can get really lost. You can definitely spend a lot of money on supplements that may or may not be helpful because it's really just a medical cause. So I think it's really important just to establish a very well-rounded healthcare team. I know, Kristen, as you mentioned, you often refer to doctors, you often get referrals from doctors. I think that collaboration between a medical team is in the patient's best interest. And so it's important to keep in mind that it's probably not in your head, and that you do want to expand your network of your healthcare team and just make sure that you've got your bases covered. That's the safest, that's the most efficient way to get to the bottom of what's going on for you.
Thank you. Thank you so much. I would love to invite you to have the opportunity to share with our viewers and listeners any information, if you're open to having them look you up, contact you. I mean, you might not have the time to answer any old little question or anything, but, and I don't know if you're taking on new patients at this time or would be when anybody watches this, but if somebody did want to become a patient of yours or reach out to you, what contact information should they be aware of?
Sure. I am seeing new patients at the moment, and I can be found at Natural Medicine of Seattle. Our website is straightforward, naturalmedicineofseattle.com. I think if you Google Natural Medicine Seattle, you'll find us. And it's easy to schedule an appointment with me. And all of the doctors at my practice, we all offer a free 15-minute phone consult where you can actually call and speak with a physician. They won't diagnose you. They won't give you treatment ideas over the phone without establishing a real relationship with you. But it's a great opportunity to bounce your condition off of that practitioner and say, would we be a good fit, a good clinical fit? So I do that quite frequently. It's always a pleasure to be able to speak with someone and determine if I'm really the best fit for them or if I know someone who's better. So yeah, that's how you can find me.
Thank you so much.